more precise with the tool.
It's more what?
Precise, where it's...
More precise?
Yes,
precise,
thank you.
okay.
Precise, where is the spa. With the finger, never. Wow. Super.
Yeah, it's nice. I can stay right in the spinous process.
Wow.
Yeah, right there.
Yeah. Oh,
I can feel more with the tool than I can with my fingers.
me too.
So Ruth, this is the first time you've used the
This is
tools?
the first time I've used the tool.
Yeah. So how's it? I have many people that think that the tools are going to be difficult to use, or they're not going to feel as good as having your hands on the person. Well, clearly you have both your hands on the person even using the tool, which is the way I've designed them. Any comments? Or
Actually, it's much easier than using my fingers. I can feel more because the head of the tool is right down into the laminate groove here.
And as you move along and you find spots that are tight, you can actually feel them through the tool or not?
I can feel them through the tool. I can much better than I can feel them with my fingers.
The whole idea of the tools is to do a better job, a more thorough job, and for your hands to be as close to on vacation as possible while you're doing the work.
It is very much more comfortable than having to push and prod to get in. This is very little effort at all.
And as the patient, how is that?
Karina?
Fantastic. You feel so deep. I didn't believe this. Super. You can push with your finger. You cannot come so deep in the muscle. Wow. Super. You cannot feel the tool on your skin.
If I didn't tell you I had a tool, would you know?
No. And I receive every week now 1, 2, 3 massages.
And of course you can apply as little or as much pressure as you need as the therapist as well. You don't have to go in because you can and work extremely deep. For those people who need that, it's terrific, and those that don't, you can work much more gently.
Yeah.
And I can see how you've taken to how to hold that tool really quickly. You've got both hands touching the body, and you've got your fingers sensing where the tool is, and you've only been using that 4 or 5 minutes, I believe.
Yes.
Wow, he's
Do you want to try the Best Friend tool for a minute?
Sure.
So this is the first time using the Best Friend
First
tool.
time.
wow,
My pressure okay?
super.
And that right hand, I mean, if it's working for you, that's just fine. I probably have my fingers closer to the tip so I could feel the spinous
This way.
process.
Yeah,
Yeah, your left hand would be okay
Okay.
the way it was.
All
Your
right.
right hand, I would probably use it a little bit
okay.
more. So put that left hand right down on the tool. Yeah.
This way.
Yeah.
Okay. All right,
And
then
again,
keep this one
remember
to
that your hands are just supplying energy. Your shoulder, your body weight's doing all of the work. Your hands are just relaxed. You know, when you first start to use it, you'll use your arms still, but you'll learn fairly quickly. And one thing that I often say is to keep in mind to keep your right pectoral muscle relaxed. If that pectoral is not relaxed, that tendon can be a little sore on the crutch tool. But if your muscle's relaxed, it's super comfortable.
I'm going to try going a little more into the laminate groove this time.
So you can use that for some nice long effleurage, or you can use it to really, that tool will cover the entire laminate groove group, or 85% of it. The iliocostals that go out into the ribs, you may not be getting all of them. You're going to need most of them.
Alex, if you want to sit here, I have a stool.
And now that tool has 2 other tips as well that you can use, but you probably won't.
Wow, it's so good.
brush it just more like an effleurage. How was that?
I see.
So the subscapularis is probably, in some areas maybe even fused to the ribs.
It is.
Yeah.
Yeah.
But this is the furthest we've ever been able to get
Get under with the tool.
under.
Yeah, because you can't use your hands
No.
to get in there.
For years,
Yeah, I
I
like
kept saying, someone should invent something that will go underneath this subscap, slide under.
Yeah, now have her arm down
And
there.
one day I decided, well, if somebody's going to invent it, I guess it's going to have to be me. I would come even right up
Even
over
further.
here. And just let your arm hang straight down, perhaps, if you don't mind. And there's a position
Yep.
when you start to get in there a little more, where if you lay the person on their side and they actually support the arm,
Oh, right.
you can pull it
You can
towards
get in there a
yourself
little
and
bit
get in
more.
even better.
Oh yeah, you can't get up there with your fingers.
Well, it certainly is painful.
What is this?
And because of that, many therapists just don't do that. They don't treat it because it just hurts them too much, so they don't do as good a job as they could.
Deep breath.
I'll try.
Okay.
So this is supposed to be more like the T-bar, right?
That
This
one
is supposed to
originally
be more
invented
like that?
mostly to do the subscap
Okay.
because you could get a real good hold on it.
Okay, what about this one?
That one is just the typical thumb tool, and you got
Just
the
the
wrong one.
thumb
That's for
tool.
your other hand, though.
That's okay. Did you try this one yet?
I had it done on me.
And I don't think
This side?
you were here when I was showing them, but if you turn that at a little bit of an angle as well.
Or this
No,
side?
no,
I
same
did the right side, right?
Yeah, but just twist your hand a little bit. No, not tilt. Actually twist. See, now you have you're closer to the spinous processes,
Oh, look at that.
and in this position, you're further out. So if you want to treat out further, or if the person has bigger spinous processes.
Okay. And what about going up into
Wow,
the,
this is good.
This tool is so new
Cups?
that I don't know what all it's going to do, but does that feel good?
Yeah.
I think it feels
Yeah.
great. And going up into
Wow.
here too. Right in those suboccipitals.
Yeah.
Because you know what? You use your thumb up in here and it hurts.
Yeah.
Feels good, right, Karina?
And that was the original reason I invented those thumb tools. But I have found over time that I use them less and less, and I use the ones that are in the palm of my hand more and
More
more.
and more.
If the person is face up and I'm working in the neck, I'll often use the thumb tool.
This one, right?
And I'm sure some
'Cause
people
then you
will,
could
it'll
just
feel more
use
natural
this,
to them.
right, going up and stripping them.
Now think of that you're using your hand. Now you're not using you're pressing pressing this way. You're not clenching your hand and using your hand still. Just let it relax.
Okay, so am I right now?
Yeah, I
Just
would
like
probably
that?
keep my wrist more straight
Yeah,
and
this is super.
slide like this, rather than using my wrist and doing
Slide
this.
like this.
Yeah, you're still
Oh.
flipping your wrist a little bit, which is okay if your wrist is
I
really
guess
healthy.
or maybe this way.
Yeah.
This
I
is good
see.
pressure.
How's the pressure? Good?
This is good, yeah.
Yeah. And then you can get right down in here too. I like this tool. I like them all.
Yeah, they all have
They
their place.
all work. Yeah. I
And
just
now
don't
if you
have
wanted to
use-
treat her AC joint, I would grab that one right there, and you can get right into it.
This one?
Yes, that's the one I'd probably use.
Okay.
And
Right
twist
up in here, the acromion.
right there,
here.
yeah.
Yeah. Wow, that fits right in there. Great.
And that
Nice.
tool, if you have it, you can see there's a kind of a flat edge, so
Mhm.
if you're flat against something, it's much less aggressive. If you get up here, you can change. Like if I was
Mhm.
doing the bottom of someone's foot, I would use it really flat
Mm.
initially.
Oh yeah.
I would probably initially use the other tool. But if you really need to get in, like between two
Yeah.
metatarsals or whatever,
Yeah.
you can bring it
Yeah,
up an
and you
inch
could
more.
probably use this to go right down on the spinous process, right?
Exactly. That's
Yeah.
that's
Like-
really effective. I spent an hour and a half appointment just treating between
Just
the spinous
going right
processes.
down.
So we
Oops,
get
there we
right in
go.
between the spinous process. And actually, if you'll enter a little better angle like
This
this,
way.
yeah, which might be your other hand or whatever.
Mhm.
So in between each spinous process, there's a little tiny erector muscle. There's periosteum on the bone. There's little ligaments, and then of course the rotatories attach there too, so you can actually scrape the bone all along and find any little trigger points. Those trigger points will form in periosteum as well as ligaments, tendons, fascia. And if you try to do that with your fingers,
You
know,
can,
after you do two,
yeah.
I
you
do
know,
do it with my
I used to do
fingers and it hurts.
two
Yeah.
vertebrae and my fingers were just dying.
This is awesome.
And they used to have, well, they probably still make this old wooden one with a little rubber wedge tip on it, and every 2 months it'd be worn out and you had to buy a new one. I suspect that these tools will last probably 2 or 3 generations. I can't imagine they'll ever wear out.
They'll be buried with me.
Well, you'll
There's
hand
the
them down to
therapist
your
with
kids
her
and they'll
tools.
hand them down to their kids. I don't
Yeah.
think,
Wow, that's
short of
really
a car
good.
running over them, I've even hit them with hammers and they didn't break.
Hmm.
I don't suggest you do it, but
So this flat end, what
that would
you...
be basically anywhere. You might use a T-bar. You could use it there. You could use it in the piriformis.
Okay, and the piriformis. Oh, yeah.
Oh, do you feel right a list?
And then doing rotation.
For reference, for what
tool is good for.
Oh,
Well,
my.
the videos, I show it fairly comprehensively.
Oh, yeah, this is
but
nice.
they were asking, I'm going to start filming this
Yeah,
summer a
this is-
series of
Oh.
actual courses
Oh.
This is
so that
good.
I'll teach people how to treat each muscle in the body and why you would want
Try
to treat
that,
that
that's
muscle.
good.
You can feel that? Okay.
Oh, what I did, it's hurt, you know, it's hurt.
Is it still too much, or are you okay?
No, it's
Oh.
okay. It's hurt.
God, that looks like it hurts so good.
Yeah. So you can see you can do very effective work and be
Yeah.
3/4 on vacation.
Yeah, whereas if I was using my hand or my arm, I'd be laying on top of her, so.
Yeah.
Do not believe me. We are not in the church. Just try. It's fantastic. I am just in the school and I have so. Look, my finger.
Uh-huh.
And I just make 135 massages. I'm not a nail professional. And I have pain. But
Yeah.
with this, why I have to push now, deep
No,
dish
that
massage.
feels
But
good.
the tools, super.
That's good. Yeah, get down
Just
there.
try.
Try my. Oh, wow.
I told you and I repeat.
Oh my
Do not believe
God, that
me.
feels so good.
Just try. It's an easy work and it's more effective for your clients. I don't believe nothing. I have
You're
to.
skeptical. Yeah.
Yeah.
Oh, yeah.
Wow.
I have to try everything.
Ooh, I am so sore up there.
Yeah,
Jeez. That felt good.
yeah. It's super.
That felt really good.